I started the shared medical appointments as a result of being very seriously ill between 1988 and 1992. And I found that despite having the best physicians in the world, I couldn't have asked for better doctors, but the system itself was broken. It was so frustrating. It was the appointments were too inaccessible, they felt too rushed, they were too frustrating for the doctor and myself as well, and I just began to feel that there has to be a better way.
Harvard Vanguard has been for 30 years a leader in innovations in healthcare and healthcare delivery. And so it's not surprising that once again we would be leading the country in creating higher quality care. People ask, why are we doing this? Why are we developing this different model of care? And the answer is simple. We're doing it because it's better patient care. It benefits the patient, it benefits the physician and the clinical teams in being able to perform their job better, and it is also a highly effective and efficient way to deliver care. From a physician's perspective, there are many, many advantages to the shared medical point model. And in fact, this was one of the first things that attracted us to this particular approach. And if you think about it, we are social beings. We work together, we try to eat together, we socialize and play together, we even pray together. And so why wouldn't we seek our medical care together? And again, that's the experience when you listen to the physicians and the nurses and the other clinicians and the medical team that have participated, and the patients who have participated in this approach. When you listen to them, you will hear that mindset over and over again. This is probably a better way to practice and receive medicine.
I'm surrounded by the support network that's going to ensure that this quality of care is being provided. And at the same time, I can kind of sit back and enjoy the conversation. I mean, medicine is a wonderful field, but ultimately it's actually the relationships that you're having with your patients that make the day fun. And in this kind of a visit, we can all have a little bit of fun.
It's been a constant problem here at our site has been access to physicians. So for example, I've been able to see like probably 3 or 4 times my usual throughput in the same amount of time. If my patient's sick, I can see them myself instead of having someone who doesn't know them as well see them. Patients really like that. They call up and they say, you can come in an hour. Patients almost fall over because they're not used to getting such prompt appointments. So.
It really blew me away to some extent that patients would view it in such a overwhelmingly positive light. And just yesterday, for example, we had 13 patients, and of those, every single one wanted to sign up for another SMA visit. And the one who didn't said, I'd like to do it every other time. So it showed that the patient is the final arbiter of the value, and I felt that that was a good testimony from the value from the patient standpoint.
I love the fact that the patients are so excited about it. They feel like we're offering them a choice that they've never had before. And even the most hesitant patient will come down, and even though you might watch their body language and they appear to be not sure if they're in the right setting for them, they warm up. It's one of those situations where seeing is believing. And I have observed a few of them now, and what I like about it is I love to see the expression on the patients' faces as the group progresses. They really get into it. They learn from each other. There's a lot of chatter. There's a lot of sharing. There's a lot of cross-education. And that is very fulfilling from my perspective.
I still see patients one-on-one, but I think that a lot of patients are interested in the group experience and that they can benefit not only from me and the fact that the infrastructure is helpful. You know, the fact that all the appointments are made, that the follow-up is made, the lab tests are done. It makes it less stressful for me. I get to review the charts, say, yep, we're on the right track. Makes me think, you know, when should I see them again? What are the tests I need to do? And all of that gets done.
It decreases the number of phone calls that we get because so many more questions are answered. Patients can't think this, they have a certain amount of anxiety, so they can't think of all of their questions. But when you have 8 people thinking of all different questions, many more questions get answered in a timely way. And so you don't have a ton of phone calls coming in after the appointments.
8-year-old who has asthma, of course, and he was in the group and he was asked to demonstrate how to use a peak flow meter. And I think he was an MC in his former life because he got right up, explained what it was for, how many times you had to do it, and how worthwhile it was. So he showed the other 6- and 7-year-olds in the group as well as the parents.
People talk about things that are common to almost everyone. You know, some people have the same symptoms, maybe not as pronounced, but they know when you have something like diabetes and high blood pressure, a lot of people have those same symptoms. And they have a lot of different antidotes for those things, and it works out, that's what I like the most about it.
So what we're going to do, Jim, we're going to see you back in about 3 months, and we'll get the lab beforehand. We're going to do some lab today because I want to check on the potassium and those other things we mentioned, and you're doing a great job. You're consistent. So
When you get congratulated a little bit on how well you're doing, that makes you want to strive a little bit better. You know, you feel like the doctor, Dr. Drake especially, is really interested in your health. And if you just meet him halfway, you're going to do all right.
I really enjoyed it because I was able to hear how other parents are dealing with their children in asthma. Zachary is only 22 months, so he's really young to have asthma. We've been dealing with it since birth, so hearing other parents have more than one child with it is interesting to hear their reaction and how they're dealing everyday life with this. Probably one of the better doctor appointments I've had because you have so much time to think of questions, because so many times you leave a doctor's office and you're like, I forgot to ask that question. And actually some of the parents asked the questions that I was thinking of asking. So that allowed me just to sit back, listen, and say, okay, my questions have been answered. Definitely recommend it.